Hey, this is Brandon Steele with Chiro Up. Today's blog specifically covered lateral elbow pain. However, that's not the purpose of the blog. The purpose of the blog is to understand four main components of treating really anything in your office. The first one has to be to get the accurate diagnosis, because when we start treating pain or we start treating problems, it can't just be treating the region. It really has to be coming up with the tissue source of pain. What is really causing that? Now, sometimes it's MSK. That's what we see the most of. However, also rule out metabolic issues, psychological issues. Those can obviously also be at play. But when it comes to MSK diagnoses, it's not just lateral elbow pain or lower back pain. Treating those in the exact same way for every single patient that comes into your practice is not a great way to practice. One better way to practice is identifying the exact tissue source. So in this case, we have a tendinitis. A tendinitis is going to be an inflamed tissue, an irritated tissue, too much activity in an acute setting. That's going to be treated very differently than other things that are more chronic in nature. If I had an itis, I'd want to calm things down, stop doing the offending activity or the traumatic onset, and then go about that person's daily business. But if it's more of a tendinosis, where there's been a chronic repetitive strain, activity, hobby, habit, then I'm going to treat that very differently. I still have to take them through that calming down phase. I still have to get things to calm down, but then I need to go about building things back up. Now, I don't care what you use as far as calming things down. There's manipulation, there's soft tissue techniques, there's instrument system manipulation, there's a slew of different soft tissue techniques and different tools that we can use to get things to kind of calm down and get the pain to go away. But then you have to build things back up, because that tissue exceeded its capacity and is now degenerating. It's not able to perform that task. We have to make sure we build up that capacity. We use rehabilitation exercises, start with isometrics, then build them up through some eccentric exercises. It seems to work well for us, and also it works well and fares well in peer-reviewed literature. But sometimes it's not even that. Sometimes they have, in this case, a lateral elbow pain, but it's not muscular in nature. It's not tendinous in nature. It's something else. And that's when you really have to dig into someone's life. You have to listen to their history. You have to be present in that history-taking process. Not just take notes, but also think of leading questions to ask that person to get them to reveal their diagnosis. If they have localized pain, muscle, tendon, ligament, but now if they start to get radiating pain, numbness, tingling, burning, those kind of symptoms, we need to think about a different tissue source. In that case, maybe a nerve like radial tunnel syndrome that we're going to read about in today's blog. But make sure you can match or marry the symptoms and the history taking compared to your orthopedic exam, because it's really going to help differentiate what's going on. I cover this later on the blog, but just by doing the same three tests, we can get very different results based on the tissue source of pain. So make sure you're very astute in understanding that Mills test can be positive for lateral epicondylitis, lateral epicondylosis, and then also going into your radial tunnel syndrome. So making sure that you're able to differentiate what the tissue source is going to be the first and most important part of assessment and treatment of any condition. Second, this gets left out a lot, and I don't know why, but I have a feeling it's because it takes a lot of time. And that is, eliminate your aggravating factors. There are so many times when you're going through a healing process that you're doing the same thing over and over and over again, and you're making yourself worse. And patients don't want to make themselves worse. They just don't know what it is they're doing to create that situation. So we have to eliminate those aggravating factors. For example, in people with lumbar spine disc lesions, bending down and stretching and touching their toes every morning probably isn't a great strategy, but it feels good. They get that stretch reflex, so they keep on doing it, and they're creating their own problem every morning. In the case like lateral epicondylosis, we have to make sure that we allow that tissue to heal, avoiding external compression. So things like sleeping, that was in 2 blogs ago, but sleeping on your elbow, and there's a lot of people who do that. They're creating ischemia from that long-term compression and not allowing that tissue to heal. Something else that we do very frequently, myself included, is including a counterforce brace across that area. Well, if you're creating compression and long-term ischemia to that area, are you allowing it to heal? So yes, while you're possibly doing activities that could aggravate it, is it a good idea? Yes, but when they're not doing those activities, watching TV, just eating, you can probably take those braces off. Another thing to think about, this wasn't in the blog, however, when you have issues with wrist extension, and wrist extension is going to activate those wrist extensors, elbow extensors and wrist extensors, you're going to have pain here. So you put that brace across there and it takes their pain away. Sometimes you can even put them in something like a cock-up splint to prevent that wrist range of motion, and it will help the elbow. So you can prevent range of motion from the wrist and really help with symptoms at the elbow. It's not as great as a counterforce brace, but it does a really good job on a lot of patients. The last piece that I want to cover, at least in video format, is the very end of this blog, because I think that's the most important part of the blog. And that's really the reason I wrote the lateral elbow pain aspect of it, is that we are the best option. Conservative care is the best option for these MSK type diagnoses. That when you take a look at the Khan study that was at the very bottom, I think it's a reference number 4, it talks about wait and see, and it talks about steroids and what is better for these lateral epicondylitis patients. Do steroids help? Yes. In the short term, they do take away inflammation. However, if you look at the types of diagnoses that we have, is it an itis or is it an osis? And what the radiology studies say is that tendinitis is extremely rare. It is very, very rare to have a tendinitis type patient because that inflammation dies down within a couple days of the initial injury. So if you have somebody that's gone through, they've seen their primary, they've gone to imaging, that inflammatory process is long gone. They're more of an osis patient. So in doing an injection, yes, that'll take the pain away, but that's not a good long-term solution. It gets you to that calm down phase, but not to that building up phase. So waiting and seeing, doing cortisone injections, those are not great ways to get these pains to go away, because a big bucket of those patients are actually tendinosis patients. Those patients need to be built back up. So consider doing strategies to help it heal, and then also, of course, building up the capacity in those tissues with your isometric exercises, with your eccentric exercises. The last paper on this blog was about Croslock, and it talked about getting these patients to heal with conservative measures, but what if it fails? And a lot of surgeons will go in and clean up that degenerative tissue, essentially scrape away that degenerative tissue. It can help in the short term, but long term it offers these patients no benefit. And the reason is because whatever caused that problem to begin with is still there. Doing the same thing over and over again and expecting a different result is insanity. So when people have these kind of MSK issues and they've gone on long enough to create a degenerative condition, we have to be able to address it, assess it with our orthopedic exam and history taken, and then figure out how to get that pain to go away and stay away as fast as possible. That's how we create great value for our patients. It's very difficult to remember how to do every orthopedic exam and every rehab exercise, and learning how all those aggravating factors can influence an orthopedic examination. We all do our best, and I do my best. However, it is very difficult. ChiroUp helps in that process. Being able to recognize conditions, communicate with my patients, that's what I'm great at. I let ChiroUp do the rest of it, meaning all the activity modification, knowing which exercise to give that patient depending on where they are in their care, and then learning about these studies can help inform the patient on what their options are. I hope this helps. If you have any questions, Brandon@chiroup.com. You can contact us anytime, and hopefully we'll have the right answer for you. And if we don't, we'll find it.